Good afternoon, graduates, family members, colleagues, and distinguished guests. Before I begin my brief remarks, I must tell you that I did not fly down here in a government helicopter, nor did I bring my golf clubs. Dr. Newman, thank you for your gracious remarks. Indeed, it is an honor to have the degree Doctor of Ocular Science conferred on me by the Southern College of Optometry, and to share the recognition with all the dedicated men and women of the Veterans Health Administration. I'm most appreciative. Let me take this occasion to also thank President William Cochran for his participation as a dedicated leader of the Association of Schools and Colleges of Optometry. His advice and counsel over the past 4 years on numerous national patient care and educational issues have been invaluable to me. On behalf of Dr. John T Farah, Acting Undersecretary for Health, Department of Veterans Affairs, I bring greetings from Washington, D.C., and his gratitude to the college for its continued support of the VA's mission of patient care, education, and research in serving the nation's 27 million veterans. A special thank you to my VA colleagues for their presence this afternoon. Dr. Sarah Carter, Chief of Ambulatory Care, and Dr. Gary Brough, Chief of Optometry from the Memphis VA Medical Center. And to the graduates, congratulations, commencement, the end of your demanding didactic and clinical preparation and the beginning of your professional careers. Thank you so much for inviting me to share it with you. And my compliments to Dr. Daniel Smith for a most impressive class president's address. Since my arrival in Memphis, I have had the opportunity to meet members of the 1994 graduating class. These men and women, as representatives of intelligent and dedicated graduates in optometry nationwide, virtually assure the further success of our profession. From the settling of the frontier to the landing on the moon, America's had a continuous story of challenges defined and obstacles overcome. Our history tells us we can meet this new challenge as well. After decades of false starts, we must make this our most urgent priority, giving every American health security, health care that is always there. President William Jefferson Clinton. Health care reform is currently being debated in the United States Congress, state legislatures, and by nearly every element of the health care system. Most Americans are dissatisfied with some aspect of health care, but they are also apprehensive about what kinds of changes are ahead. The reasons for change need little elaboration. Upwards of 40 million Americans without health insurance and facing restricted access to health care services. Health insurance premiums reaching levels that neither employers nor low and middle income families can afford. Health care now represents 14% of the nation's output of goods and services, $1 trillion. The quality of care is inconsistent, and excessive health care resources, including training programs, are positioned in specialty areas, while major deficits exist in much-needed primary care services and clinical training. How must health care in America change? I believe we must and will have universal entitlement, health care security for all Americans, health insurance you and your family will never lose, no matter what. Major structural changes are also required in all aspects of the current system. We must reach a proper relationship between the number of primary health care providers and specialists. Access to health services must be improved, cost controlled, and quality assured. And any new health plan must support training of primary care providers, including optometrists. 10 states have recognized the need for change, and already have health reform legislation in place, including the leadership state of Tennessee with its TennCare. As a healthcare administrator, I'm frequently asked about the President and Mrs. Clinton's health reform initiative. I believe it is the right plan for the Department of Veterans Affairs, the right plan for the American people, and the best plan for optometry. The President's proposal explicitly provides eye and vision care benefits and recognizes optometry's primary care role. The progress of the optometric profession over the past 20 years has been dramatic. I attribute this success to a sincere desire on the part of practitioners nationwide to provide more accessible and cost-effective care to their patients. An expansion of the clinical practice of optometry to include the management of eye diseases and prescriptive authority has been central to the recognition of optometry's primary care role. As a result of this dramatic progress, I believe optometry is now positioned to assume the role of primary eye care provider under national health care reform, and the class of 1994 is uniquely qualified to meet that challenge. Optometrists are the most accessible eye care providers practicing in more than 6,800 municipalities throughout the United States. In more than half of these communities, they are the only eye care providers available. Optometric clinicians are often the only point of contact in the health system for many people, and their training qualifies them to serve in a role for patients with systemic health problems that manifest in the eye. This is particularly important in medically underserved areas. Enhanced primary care training for optometrists is consistent with the current direction of federal health care policies which emphasize primary care. Vision and eye health problems are among the nation's most prevalent, affecting more than 140 million people. Vision problems inhibit the ability of children to learn, adults to work, and the elderly to live independent and productive lives. Regular eye exams are also an essential preventive measure for the early diagnosis and prompt treatment of eye diseases, which, if undetected, result in individual suffering and added societal costs. A recent study by the Georgetown University Medical Center has concluded that the over 100,000 of the new cases of blindness yearly are preventable through timely detection and treatment, and would result in an estimated annual savings to the federal budget of $1 billion. The demand for services of primary care providers in the United States continues to exceed the supply of manpower resources available. Healthcare reform provides an opportunity to restructure the delivery and health education systems in ways that make better use of America's available healthcare resources through the use of cooperative approaches to health delivery and training. I would like now to turn to a discussion of cooperation and coordination among providers. Optometry and ophthalmology are complementary eye professions in the VA and elsewhere in the nation. However, interprofessional controversy over certain issues persist. These issues include the extent of clinical privileges for optometrists, the role of the optometrist in pre- and post-operative patient management, and the use of laser technology by optometrists. Sensitive issues are not easily resolved. However, there are many areas of mutual agreement, and I believe the eye care professions can and should cooperate in patient care programs, in education, training, and research. These types of cooperative programs already exist in some VA facilities and other healthcare institutions in the nation, but on a limited basis. The success of cooperative programs between optometry and ophthalmology is evidence that their joint efforts can be advantageous both to medicine and optometry, and that optometrists and physicians can work together as colleagues. The VA Eye Care Program is one example. The Department of Veterans Affairs has the largest eye care delivery and ophthalmic clinical education program in the United States. We have a dedicated, talented, and enthusiastic eye care staff with proven scholarly achievement. A large part of the success of the VA's program is due to the strong support from affiliated optometry and medical schools. Progress of optometry in the VA parallels the progress of the profession over the past 2 decades. The VA optometry service was created by public law in 1976, with only a few optometrists in the system at the time. The first VA program for training optometry students was initiated in the 70s at the Birmingham VA Medical Center, affiliated with the University of Alabama School of Optometry. The nation's first residency program followed at Kansas City VA Medical Center. Dr. Melanie Crandall, a distinguished member of this college's Board of Trustees, was one of the first Kansas City residents. Today, 260 optometrists provide eye services at 144 medical facilities. Clinical training for more than 500 optometric students and 67 residents is conducted at 87 academically affiliated VA facilities. Some of today's graduates served extern rotations in VA medical centers. Also, I wish Dr. Jamie Durden, co-valedictorian of the class of 1994, success in her residency program to begin in July at the VA Hospital, Tuscaloosa, Alabama. I'm delighted she selected the VA for postgraduate training. In addition to providing primary eye services, doctors of optometry and optometric trainees participate in several special programs. To assist visually impaired veterans, 6 blind rehabilitation centers located from California to Puerto Rico provide comprehensive rehabilitative services. The VA Optometry Service also operates 3 Victors programs, one in Northport, New York, one in Chicago, and one in Kansas City. Victors means Visual Impairment Centers to Optimize Remaining Sight. Victors provide care to visually impaired veterans who might benefit from the use of low-vision prosthetic appliances, devices that can improve the quality of life of these veterans, permitting some to return to work, others to read, and still others to enjoy the smiles of their grandchildren. It is our hope that we will soon be able to add new Victors programs in the West and in the South. In the area of research, clinical trials are now being conducted in a low-vision enhancement system in selected VA facilities. The system, developed by scientists from the Johns Hopkins University and NASA and supported by the VA, is known by a very appropriate acronym for this part of the country, ELVIS. It is a lightweight, portable, head-mounted video display system with television cameras on the frame. Among many features, the device enhances the contrast between objects. The system will accept any video input from a video camera, a tape player, a television receiver, or a computer graphics board. We are very excited by this research and its potential benefits for the aging veteran. There are an estimated 560,000 veterans with severe visual impairment, and this number is expected to increase to over 800,000 by the end of the decade. This device will also be soon available to all Americans. In closing, I present a challenge to my colleagues who are deans and presidents of affiliated optometry and medical schools, to the VA eye care staff, medical center leadership, and to today's graduates, tomorrow's leaders. My challenge to you is to develop, implement, and evaluate approaches to optometry, ophthalmology, patient care, education, and research. Your challenge is to develop eye centers that would serve as a means to influence the future of all ophthalmic care. Given the necessary resources, together with the excellent cooperation the VA enjoys from our affiliated health profession schools and the dedication of our own eye care staff, I believe properly constructed and thoroughly evaluated eye centers of excellence could serve as models which stress preventive care, but at the same time provide state-of-the-art treatment and rehabilitative services. Models which could be emulated throughout the national health system. The future could take us into a new era of accessible, affordable, and quality health care and lead optometry into an arena of greater responsibility for the eye needs of all Americans. With your leadership and continued dedication, we can and will succeed. Thank you very much. It is a pleasure to be with you today.